Chinese medicine herb may have the power to help heart attack patients. This was published in Newcastle University's newsletter, published on April 28, 2023. A plant-based compound purified from the traditional Chinese herb Astragalus has the potential to improve the outcome of heart attack patients, new research has revealed. Reducing inflammation is considered a key treatment target following a heart attack for patients, and our study showed a TA/65 reduced inflammation by up to 62%. Experts at Newcastle University have found that the product known as TA/65 significantly reduces inflammation and, unlike current cardiovascular treatments, does not negatively impact immunity. The study published in Geroscience showed that when TA/65 was given to older patients for over a year after their heart attack, it specifically increased lymphocytes, improving immunity of patients. And in addition, patients treated with the drug experienced far less complications or issues such as chest or joint pains following their heart attack. Reducing inflammation. Locum Spiridopoulos, a professor of cardiology and cardiovascular gerontology at Newcastle University, has led the study, working with the heart team at the James Cook University Hospital in Middlesbrough. Professor said, "It has become widely recognized that inflammation plays a key role in the formation, progression, and rupture of a coronary plaque, which induces heart attack, but most importantly, it's also a major risk factor for further complications. Reducing inflammation is therefore considered a key treatment target following a heart attack for patients, and our study showed that a TA/65 reduced inflammation by up to 62%. While some potent anti-inflammatory drugs have been shown to improve outcomes after heart attacks, they resulted in suppression of the immune system and increased the risk of severe infections. In our study, the widely available drug TA/65 was shown to reduce inflammation, but also appears to improve immunity by increasing a patient's immune cells. Scientists, including experts from the James Cook University Hospital, carried out a randomized controlled pilot study in which patients were given a placebo drug, or TA/65. The study was carried out on 90 patients aged 65 and over and performed as a clinical trial for medicines under the Medicines and Healthcare Products Regulatory Agency conditions. Patients had blood measurements taken at baseline, 6 months, and a year to assess the study outcomes. Participants were reviewed regularly in the clinic to check them for any side effects. TA/65, a patented plant-based compound that helps maintain or rebuild telomeres. It's isolated from the herb Astragalus, a traditional Chinese medicine for thousands of years. Those who received the TA/65 drug had few adverse effects, such as fever or new medical problem following their heart attack, and in fact showed 30% less adverse effects than the group given the dummy drug. Professor Spiridopoulos also works at Newcastle and Tyne Hospital NHS Foundation Trust, and said, "If you can show that TA/65 improves the clinical outcomes of patients who have suffered a heart attack on top of modern treatment options, it will become an important addition to patients' medical care. The research team would like to follow up with a further study to confirm that the results in a larger trial are funded, and further research will focus on whether TA/65 reduces adverse cardiac effects, such as more heart attacks or even death." Dr. David Austin is a consultant cardiologist at the James Cook University Hospital, and he was an author on the research paper, and said the James Cook University Hospital unit serves more than 1.5 million people and has an excellent reputation. Our partnership with Newcastle University in this research study is part of a drive to continually improve treatment options for patients, and the independent study was funded by TA Science, a company that makes a TA/65 drug, and there was an investigator-initiated trial, meaning the company had no say in how the study was conducted or analyzed.